Okay, we're going to talk about ethics and measurement. And what we're really talking about when we're talking about ethics is that ethics are expectations set by the actual profession, the career, or even professional organizations that oversee a particular business or industry. And in this case, what we're talking about is the industry, the business, the field of psychology that involves psychological tests and measurements. So the general ethical principles for anyone that is creating tests, administering tests, interpreting tests, or involved in the testing process. Now, in many cases, these ethics are not necessarily backed up by any particular legal requirements. They're often just expectations of good practices in the field. Though we will talk about in some cases there are actual additional legal requirements that back up these ethical principles. So the first thing we're going to talk about is one of the broadest ethical principles for testing is that the administrators, the people that are going to use the test, need to be qualified. The test publishers, one way they put teeth behind this ethic is that many test publishers will restrict access to tests based on kind of three broad levels of qualifications. Now, in each case, what these qualifications are trying to get at is whether or not the person is competent to actually administer the test. And we're going to talk about what competence means in the next slide. But the first level is the simplest level. Basically, it's measuring whether you're competent to use a test based on whether you've had a particular course in measurement, maybe one single course. You might be specific to the discipline that's being tested. So, for instance, if you have a lot of training in clinical psychology and it's a clinical assessment, or maybe it's even just an assessment on depression, and that's actually your discipline, is that you're a depression counselor. Or you're being supervised the test administration and interpretation by someone else. So I can administer a test, for instance, if I would be competent simply from taking a single course in measurement, or I'm an expert in my field, or I'm being overseen by someone that is more competent in this particular test. The second and kind of higher level of qualification is level B. And it means that someone has completed graduate training in measurement, so this is beyond a single class or a single course just in the test you're taking. And when I said in course level A, a course in measurement, that could also be you took a training course for that particular test you're giving. So B is more you have additional training. You had more than a single class. You have some general background knowledge in measurement. You might actually have some assessment and some knowledge of individual psychological assessment, or some general knowledge in research methodology and tests. Now again, if that training is enough to make you competent in testing, and again we're going to talk about competency in the next slide, then that's enough to be ethically okay for you to be qualified to administer the test. And the final level basically is someone that has been trained specifically in psychological test and measurement. That is what their field is, psychological test and measurement. So they've completed a recognized graduate training program in psychology with the appropriate coursework and supervised practical experience in the administration and interpretation of various clinical assessment instruments. So these three levels are kind of used, again, as ethical guidelines of whether someone's qualified. And when we're talking about qualified, we're really talking about, are they competent to use the test? So to ensure competence, whichever level is required is a test-by-test question. But competence means that A, the administrator understands the methodological aspects of the test. So the reliability issues, the validity issues, the norms, the structure of the test. Now, the simpler and more established the test is, the less important this is for competence. The more recent, the larger, the more complex, and possibly also the more controversial the test is, the more important competency in understanding the test's reliability, validity, and norms is important. The person needs to be competent and familiar with the administrative procedures of the particular test. So again, depending on the test and how complex this is, determines the level of qualifications that are required to be competent. So for instance, the WAIS must be scored during administration. So you have to be an expert in the WAIS, because you can't just give the WAIS and get the results from someone and walk away and you're done. You're actually scoring every part of the WAIS as the person takes that test. Again, a more simple test, the ACT, you at least need to understand that the ACT can't just be handed to someone and told to go out in the hallway and take a test. The ACT has a time restriction, it has very standardized instructions, and it should always be taken in a very controlled environment. The reason for this is that these factors have been found to impact test performance. So again, just understanding the requirements of the test. And finally, the person needs to be trained to interpret the results of the test. So what does it mean if someone draws all the numbers in his clock on the right side? And again, some tests are fairly easy to interpret. If you have a 5-item measure of job satisfaction, and it's overall job satisfaction, you might only require kind of level A qualifications. You've had a few classes in measurement, and you pretty much know, well, low scores mean that you have low job satisfaction, and the higher the score, the higher the job satisfaction. But if you're giving a cognitive assessment that is based on how people interpret images and drawings to look at possible cognitive brain impairment, there's a lot of nuances that you need to be very familiar with to be able to properly interpret that test. So again, to ensure competence, we need to find out how important is it to know the methodological issues of the test, how familiar must you be with the administration procedures and how complex those procedures are, and also how much information do you need to know to interpret the tests and to interpret the test properly. And based on these competence factors, that determines then the ethical requirements to be qualified, whether you can be qualified with just a little bit of training, some general training, or you really need to be specifically trained to be qualified to use the test that you're using. And again, these are ethical requirements that we need to be asking, is the person using this test qualified and competent to give that test? Another general ethical principle of testing is to obtain informed consent. So you're probably familiar with informed consent in the framework of running research sessions in various classes as a psychology student. And you probably are familiar with the fact that when you run a study, part of that is that your participants are often given a form or a large sheet that lists why they're actually being involved in this study, what are the possible procedures, so what's going to happen in the study, is there any risks, and what's the benefits. The same requirement is for any time someone's being given a psychological test. Though they're not necessarily in an experiment, they are being tested, and they have the right to know what is being tested, what is the testing procedure like, is there any risk to the testing procedure, and also what are the benefits of them taking this test. They have the right to make an informed decision of whether or not they want to take that test. Now, again, there might be some legal situations where someone is legally required or basically mandated to take a test, and that would be somewhat different. Also, if the person is not capable of making informed consent, in other words, they are not capable of really understanding these issues, then a legal guardian must allow consent before going forward. Now, in most of our psychological tests that we've talked about in this class, there is not going to be a formal process of informed consent. There's going to be implied consent. So, for example, when you walk into the GRE has been ethical, and they have provided numerous resources for you to know how long is this going to take, what's involved, how many questions are going to be asked, what kind of questions, what's going to happen with the results, and what are the benefits and risks of me taking this test. Therefore, you're not having to sign an informed consent. You've got implied consent that you've agreed to come in to take this psychological test. Also, if someone comes in and talks to a clinical psychologist and starts to talk about their problems, and the clinical psychologist starts to do a clinical interview assessment, there's implied consent there. You have come to this expert to get this type of treatment. However, it is still the ethical responsibility of the person giving those assessments to make sure you are actually making an informed consent. So it is somewhat the responsibility of the clinical psychologist for that case to go. So I recognize that you've come in here and talked to me. Do you want me to start actually doing a clinical assessment so that we can get to the root of your problem? There is that implication still there. There's an ethical requirement for anyone giving tests to make sure that the results are somewhat available to the people taking the test. So the examinee, the person taking the test, has the right to get access to the results of the test. Now, that sometimes doesn't mean they have the right to the raw data of the test, but they definitely have the right to know what is the determination or the overall results of the test. So results should be explained in a manner that they can understand. So ACT or GRE scores are provided to students along with a brief interpretation of those scores, often including a percentage of where their score actually fell amongst all the people that took the test that year. So ability test scores generally need to be explained in terms of the norms for each student and each subtest. So if someone takes a test, they need to know what their raw score is, but also how that score compares to other people and who those other people are they're being compared to. Ethically speaking, if the results are not thoroughly provided to every examinee, administrators still need to provide an opportunity. So, for example, if an assessment is actually being used broadly to determine, for example, job satisfaction of an overall organization, if someone wants to actually see their particular scores, they should have an opportunity to ask for such access. And this often can be found also in experimental studies in psychology, where at the end of a study, often we can say, if you're interested in the results of this study, please let us know, and we can contact you later once the results are in. That's the same concept, this ethical principle that people do have the right to find out what's being done with the data they're helping to provide. So, there is also an ethical requirement for people administering tests to maintain confidentiality of individual scores. So results of an individual cannot be divulged to unauthorized personnel without their consent of the client. So, for example, if you take a clinical assessment in a marriage and counseling therapy center on a one-on-one assessment, your spouse does not necessarily get automatic access to the records. And in fact, it would be unethical for that person to share those records with that person without your consent. Now, that doesn't mean that those scores can never be shared, but it means they should only be shared with other professionals who are also competent. In other words, they're qualified and competent to interpret the results, and they also understand the ethical ramifications of what should and should not be done with this data. And again, there are legal exceptions. So if there is an assessment that shows that someone is likely to be an imminent harm to themselves or others, oftentimes the person giving that test is now legally required to actually inform the authorities of the situation. Additionally, there's an ethical requirement that if you're using psychological tests and assessments, that you should keep those results basically secure. So the previous slide was about not sharing them with people you shouldn't share them with. This is making sure that beyond that other people aren't just getting access to them that shouldn't get access. So the results should be stored in a secure location. If at all possible, identifying information such as name, phone number, social security, and email should not be on final data sets. And again, this does not mean that it can't be shared with anyone, but it should only be shared with people that are authorized for training and research and also understand the ethics of the testing data. So often graduate students might have access to archival data such as previous psychological assessments, but again, the identifying patients information should be off of that data, and the graduate students themselves know they're not supposed to be sharing this results with other people. Our final ethics is test construction. So test developers are responsible for testing the reliability, validity, and norms of tests. And they're also ethically required to make sure that those reliability, validity, and norms are up to date. They should be reporting those results honestly and accurately and making them available. And even in situations where there's automatic scoring, so basically the test has been constructed and it's no longer being interpreted by individual test administrators, it is up to the company that is maintaining, or the experts that are maintaining this automatic scoring, to make sure that it is still accurate and the interpretations are still valid and up to date. So, for example, Scantron scores are not always final. They need to be checked occasionally. So any kind of automatic system, is the actual Scantron systems properly identifying the marks that people are putting in their self-scoring automated scoring sets? Is the actual answer key still correct and up to date? Are there any errors in processing? It is the administrator's ethical responsibility to not just assume that an automatic scoring system is always working. For example, the GRE every year actually goes through their data and makes sure that the scoring system is working, that there aren't any glitches in the computer system, and that there aren't any problems with their answer keys.